here with Vivian Vega. I asked her to let me interview her today because you are an infectious disease specialist, right? Is that your title?
That is correct. Yes,
Okay.
that is correct.
And there is so much confusion going on right now with COVID-19 that I don't even know who to believe anymore. I've kind of stopped listening. There's conspiracy theories, and I mean, I don't know how somehow this virus has gotten politicized, and that's not what I want to do with this interview. I wanted to talk to somebody that I know and trust. I know you. We've traveled together. I think you were on my Greece retreat, right?
Hmm.
And scheduled to go with me on my Peru retreat in a few months, and we'll see what happens with that. But
Yeah,
I know you. And I know you're straight up, and I know I can trust what comes out of your mouth. And I thought it would be great to share this with people because I think there is a lot of confusion out there of who do we
sure. Yeah.
believe, what's true, what's real, how do we handle this? Are we even getting the truth? So the first thing I wanted to ask you is how is this, how is COVID-19 like the flu and how is it different? Because I think that's been some confusion for people that have been, and in the beginning I was saying it too. It's like the flu. Why are we making such a big deal out of it? Of course, then we got more information and I've changed my opinion on it. But you tell me, how is it like the flu and how is it different?
Sure. And I think that same thing has happened to a lot of us. We knew nothing about this virus when everything started happening in December and January. I think we knew a lot more about the flu. And back in January, there was according to what we were seeing, whether that was a matter of what we were detecting or not, there were no cases reported in the US until March, right? So all the hype that was going on in January, I can see people being skeptical and kind of trying to remind everyone, hey, we have this many flu cases in the US per year and this many deaths. Let's not, become overwhelmed about something that hasn't come to us yet. Of course, it came to us, and then now we know that it's not like the flu. So I would start by saying it seems to be a lot more efficient at transmitting itself than the flu. Of course, there's a lot of different strains of the flu, right? The flu mutates in such a way where, with the drifting and the mutations, that's why our vaccine has to change each year. So there's a lot of different strains of flu that behave differently within what we call the flu itself, right? So, but COVID-19 compared to influenza, it seems to be more efficient at transmitting itself. As a whole, it's much more effective at transmitting itself than the flu has been. That's one thing. Another thing that makes it different is that the obvious, right? It's a new virus. So we have, to some extent, a lot of us have seen the flu. So there's some degree of immunity, right? So that also goes against the flu spreading itself and the way it does, even though there's some mutations and changes. As a whole, we've seen it. It's been around forever. We get at least, anywhere from 50 to 70% of our population gets vaccinated, especially younger children. I mean, less than 5-year-olds and 2-year-olds, we were getting 70% vaccination rates. So that helps with that transmissibility and differentiating it, because so many more of us are already protected for the flu, whereas a new virus, everybody's susceptible, right? So that helps with all that transmission. That's another difference, right? Children don't seem to be as susceptible to COVID-19 as they are to the flu, right? We get a lot more flu cases in children. That's not to say it doesn't infect children, and we have seen some reports coming out of New York and Boston of some pretty dramatic manifestations in children. But as a whole, and in generally speaking, it doesn't seem to be infecting children anywhere near as much as the flu has been. The other thing people like to ask about is mortality, right? How does the mortality compare between the flu and COVID-19? And our mortality numbers, there's so many factors that go into it right now that I think it's unfair to make those comparisons. It wouldn't work because there's so many things that go into mortality rates. We've seen even from country to country to country, those mortality rates differ substantially. And that has to do with a lot of different things. It has to do with how much of your population is the susceptible group, right? So Italy, we saw the mortality rate in Italy was outrageous. It was very high. And that had to do with how much more the population is in their 80s and 90s and lived to 100, right? So they had higher, more susceptible groups, population density. So the way those deaths are reported, there's a lot that goes into it. I think you and I were talking the other day about do we trust these numbers? Do we trust these deaths that are being reported and the cases that are being reported? So the cases, there's a positive test. The health department has to report every single one of those positive tests. When it comes to reporting deaths, that's a different story, right? Because patients die in a hospital. Sometimes there's 5 different things going on, right? Can we safely say in that death certificate that everything was due to COVID? Or the opposite, right? So because people who have heart failure, who have this, and all they need is that little something to throw them over the edge. It may not have been directly related to COVID. It may have been some other things. And it also works the other way around. What about when we weren't testing that many people and we were having people dying in our hospitals, that doctors were probably thinking, I don't know, that looks a lot like COVID to me, but they were never tested, or for whatever reason, it wasn't reported as a COVID death, right? So it goes both ways. The only other thing I would say about that is also, I think that's from hospitals. That's the only thing. I think other than that, they're pretty straightforward. But that's from nursing homes, for example. That was another thing. Not everybody was getting tested. So people were dying in nursing homes and they never had a COVID test. So you can't report them as a COVID death because there was no objective proof to that. So I think there's some degree of potential underestimation until we get caught up with all of those things.
So what I'm hearing is that it is much more contagious than the flu.
Yep.
And much deadlier than the flu because of the complications. Is that accurate?
So it varies. I think there's a lot to be said about that, but it does appear right now that we're having a slightly greater mortality rates from it. But that's why I was kind of giving the caveat. And again, it depends on the flu pandemic, right? The Spanish flu in 1918 killed millions and millions and millions of Americans, worldwide and Americans. So have we seen a flu that's deadlier than this? Yeah, I would say so, but we don't know. We don't know what's going to happen in the next year or two.
So the big thing with regards to COVID-19 is the fact that it's completely new and nobody has
immunity.
Mm-hmm. Okay.
Nobody has immunity, nobody has protection, and we obviously have not vaccinated the majority of the population for it. So we're all susceptible, and that really is what brings the numbers up too. In addition to its ability to transmit itself more efficiently, right?
So you mentioned vaccine. What do you think is a reasonable expectation as to when we can expect to see a vaccine?
Yeah, so I think most of the latest studies I've seen for vaccine trials, we're still a good at least 12 months out on a vaccine. As of late April, we're still at least a good 12 months out. Most experts will say 12 to 18 months out before we have effective vaccines.
Okay. So between now and then, what is the best way for us to be handling this until there's a vaccine on an individual and on a collective level?
Obviously, this is all we think about on a regular basis because it doesn't make sense to continue what we're doing from an economy standpoint, right? Looking at the economy, it's not sustainable to keep doing what we're doing until we have a vaccine, right? So, I tend to look at it in 3 different, sort of like, how do we stop this mess? How soon? And what are the things that we need for that? Vaccination is number 1, but we know that's going to be 12 to 18 months out. So-called herd immunity, right? So have enough of our population has gotten infected so that everybody has antibodies and is no longer susceptible to the virus. Now, again, we don't know what this virus is going to do, right? So these are all theoretical things of, okay, if by the time we get to 70% or so of the population being infected, and this is what we refer to as herd immunity, is so much of the population, this is what we try to do with vaccines, right? So much of the population has either been vaccinated or had the disease that is protected from getting the disease, that we can then protect those other people that are more susceptible. That's also going to take a couple of years, right? Because where have we been trying to do this whole time? We're trying not to overwhelm our healthcare system. So we're trying to slow down the number of cases that we're getting per week, per month, because we can only take so many people in the hospital at once, right? So we are purposely delaying the time that it's going to get us to get to that herd immunity where everyone's, a good majority of the people are exposed and are no longer susceptible. So that's going to take a while. So then what do we do in the meantime? What we've been doing so far, these sort of, what a lot of us feel are fairly dramatic. I mean, it is dramatic for people's life has changed dramatically, with the social isolation, the physical distancing, social distancing, and doing it in sort of phases like this. That is really all we have. So
you're a proponent then that, okay, now we're entering into another phase where it's time to somewhat start loosening, because we can't maintain this strict social distancing that we were doing forever.
Right. So vaccines, herd immunity, number 3 being the concept of just changing our behavior in general and adapting as we go to these phase reopenings, right? So changing our behavior, meaning, okay, we know we can't sustain everything being shut down. So now we're going into this gradual reopening. And there's some pretty strict guidelines for states to reopen and how to do it and what your numbers need to be looking like before you reopen. As we do that, it's going to be inevitable, right? We're going to have, we will have another wave of cases. Is it going to be as bad as first wave? Is it going to be better? We don't know that, but you better believe it, right? We start opening up. We will expect to see an increased number of cases. It's just, so then how do we handle that? And how do we change our behavior so that as we reopen, we can still have some, stick to some degree of social distancing where, okay, restaurants are doing this and us personally, we may, Dr. Fauci said in one of his interviews, we may never greet by shaking hands ever again. I don't think any of us want to see a world like that, but that's what may happen. So for now, as we reopen, I wouldn't advise anyone to be going out into a public space without a mask, right? So even restaurants, depending on how, just keeping that 6 feet distance, and people that are sick need to stay home. But with the general principle being still, as we reopen, staying home is still the number 1 recommendation by the CDC, right? Still sticking to only essential things, essential work, essential travel, however essential restaurants are considered in everyone's lives. But if we're going to take that step, then are we taking all the necessary precautions, right? Even, I drove around to see what's going on since we've reopened somewhat, and everyone's packed together again in restaurants, even if it's an outdoor setting, the tables are all pretty close to each other still. There's this 25% capacity that the guidance says is based on the fire code, right? So, maybe 300 people can fit safely in that building. 25% of that is still a lot of people in a restaurant. It's not adhering to that every other table 6 feet apart. Is your server wearing a mask when they're talking to you and taking your order? So common sense things like that.
So I think there's a lot of confusion about the whole mask thing. Some people have said there's an argument going around right now that we shouldn't be wearing masks because we're breathing in our own carbon dioxide and it's not healthy for us. So there are people that are saying we shouldn't be wearing masks, and then there are people saying that we should be wearing masks. And if we should be wearing masks, shouldn't we all be wearing masks so that we're protecting? Because if I go someplace, if I go into a space and I'm wearing a mask but the other person is not, then I'm protecting them but they're not protecting me, is ultimately what it comes down to.
Right.
So what do you have to say about that argument that's floating around that we shouldn't be wearing masks because masks are not healthy for us?
Yeah, so nobody wants to be wearing a mask all day. working all day with a mask is not comfortable. It's not a comfortable thing. The argument that some people make is you tend to even touch your face more when you're wearing the mask, right? But we also know that, yes, wearing a mask is primarily, the primary use is anybody that's sick, and even that concern for asymptomatic spread, right, is you're holding all of those secretions into that mask. So when you're talking, or even if, even when you don't notice things running, they're being contained within that mask. So yes, you are protecting others. And then the secondary purpose is then that potential of protecting yourself from other people's secretions that are not wearing masks flying onto your mouth, your nose. So that's the purpose of the mask. And the recommendation by the CDC is, yes, universal masking. This is how we're protecting each other. That's who I turn to for who the professionals are that should be giving these, this type of advice.
Okay, so from your perspective, it's not a risk. Like it's wise for us to be wearing masks. We're not doing a disservice to ourselves by wearing a mask.
Absolutely. And as far as CO2 retention, it's not comfortable, but it's not a completely enclosed space, right? I mean, there's some CO2 is going to leak out of that mask. It's not, it's not like breathing into a paper bag in here. So as far as that goes, the other thing is, of course, we're talking about limited periods of time during the day when you're out and about in public where you should be wearing your mask, because we're still talking about trying to limit yourself to essential things and still staying at home. So even in a work setting, for example, when I go to work, when I'm seeing patients, I'm wearing my mask nonstop. Mm-hmm. When I'm in my office with my door closed, I remove my mask. Obviously, if I'm in my office by myself working, I don't need to, and my door is closed, I don't need to be wearing my mask. Same thing if any employer-employee scenario where if the spacing is such where it allows you to have enough distance, it's not like you need to be necessarily wearing that mask 24/7.
Okay.
But if you're going to be coming in within 6 feet of somebody, that is the recommendation.
Okay, so what do you have to say about, so Brian's back at work, my fiance, who he's back at work a couple days a week, and he's wearing a mask, and he's, using the hand sanitizer and doing all the things that have been recommended. When he comes home, should he be, getting out of his work clothes, taking a shower? Like, how extreme do we have to be with what's coming in the door, including we've been getting our groceries delivered from Instacart. And so should we be wiping down every single item? How far is too far, and what's necessary?
Right. So as far as coming into the house and removing your clothes and all that, I don't think that's necessary. There's no recommendation from the CDC that says that is what you should do in that type of setting, right? If you ask a healthcare worker what they're doing, because we are coming into contact with COVID positive patients who may be intubated, who may be undergoing some procedures where now these secretions that we thought 6 feet and less and they drop are going to become a lot more of a problem where they can have more distance. I wouldn't blame any of those healthcare providers from, getting home, taking off their clothes and washing everything and taking a shower. A lot of that has to do with how comfortable you feel with any of that. I shower every day when I get home from work, regardless.
Yeah.
That was from working in a hospital. That's just what it is. As far as not, other type of settings, I personally don't think that's necessary. The CDC is not recommending such measures. The CDC just recommends hand washing, very thorough hand washing, like you said, using the 60% at least alcohol-based hand sanitizer anytime you're exposed to the public, and coming home. If I'm seeing these patients and I'm going to, I do have my work Crocs that I leave at my door, but again, completely different setting. When I go to Publix, I don't leave those particular shoes. I don't do anything special with the shoes. But as far as changing, showering, I don't think that's necessary in a non-COVID hospital setting. As far as groceries, again, CDC recommendation. There's nothing that says you should disinfect and wipe down all of your groceries. It's not a recommendation from the CDC.
Not really necessary.
Yeah, because that route of transmission is really a very low risk, not as much reportable, right? Our main route of transmission is respiratory secretions, right? So mouth, nose, secretions. So touching high frequented surfaces and keeping those clean has also been recommended at the workplace, at the home, et cetera, et cetera.
Okay, so if you've had the virus and you have recovered, does that mean that I know you already kind of said we don't know for sure, but do you think that that means that we are immune at that point?
So far, we have not seen a lot of people get reinfected, right? So we do think that, yes, you do develop some kind of immunity to the virus once you've been infected. We don't know if that applies to every single person in the world, right? Because there have been a very, 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 very small number of cases of reinfection that have been reported. However, the vast majority, there's no evidence of reinfection, meaning we can make some assumptions that once you've been infected and you have the proper antibody, that you're protected for some time. The other thing we don't know is how long does that immunity last? How long will we be protected, right? Because coronaviruses are your regular common cold viruses, right? And we know you can get those a bunch of times. You don't develop an immunity to it. But some of these more major SARS, MERS, and that's how we draw a lot of we try to draw some of our sort of assumptions and conclusions we're making from the previous deadly coronaviruses, which were SARS and MERS, right? This COVID-19 is called SARS-CoV-2, right? SARS coronavirus 2, because it's 85%, nearly 85% similar to the original SARS from 2003 in Beijing, right? So we can make some assumptions, and we think that you can have immunity. Some people have said 2 to 3 years, but we really can't answer that question.
Right.
That's what evidence is pointing to, because we have not seen a high rate of reinfections.
What about an asymptomatic carrier? If you are an asymptomatic carrier and you get tested, is it going to show positive? And then will it always show positive at that point? And for how long is an asymptomatic carrier contagious to other people?
Right. So we are doing testing strategies right now in our hospitals where we are trying to put some numbers together on that. I don't think we know the answer to that as far as, do asymptomatic people always test positive? We know that asymptomatic people do test positive. We have had a share of asymptomatic persons test positive. It's a very, very small number, but we have seen it. What we don't know is, does every asymptomatic person test positive right away, and when? We don't know at which point. We do know that testing positivity correlates with symptom onset and early in the disease. We don't have a lot of those answers for people that are asymptomatic.
Okay.
So, and that's why there's this move towards universal masking, right? That's why we started doing all this universal masking, because how do we isolate, quarantine, do contact tracing for asymptomatic persons? How do we protect the rest of the population from asymptomatic persons? The only way to do that is to mask everyone. Mm-hmm. But we know the countries that have done early testing, where they tested everyone in the population, including asymptomatic persons, identified the positive cases, isolated them, did contact tracing, okay, who were they in contact with, to then quarantine those people as well for the 14-day period. Those are the countries that beat this thing early on as far as just keeping their numbers down.
Okay, so as you were talking, it made me think of New Zealand and how they've handled this situation. I think the last I heard that they pretty much had isolated, and it is no longer an issue for them. I don't know how accurate that is, but I guess my next thought is, or my next question is, how do you see this affecting travel? So, you know, you've traveled with me before. I had a couple of trips planned overseas in the next couple of months. Very curious about what that's going to look like. So what do you see as the future of travel?
Yeah, that's a very tough question to answer. I think it's going to be all over the place as far as what countries decide to do and how. I think it's not going to be consistent. That's the only thing I'm sure I'm sure of. I I don't know when normal. I don't think anybody can say right now when normal travel is going to resume. Um, all I can say is the hope with a lot of people, all the people that are involved in making these decisions, that knowing that this thing's here to stay and it's likely going to be here to stay for a long while, how do we adapt to still being able to provide travel and do it as safe as we possibly can to avoid a second and third wave of worse, right? And that's going to be, at the end of the day, comparing transportation, right? Buses, subways, metro, unless it's your own private personal car and you're the only one in it. Airplanes are the safest next thing, right? Because the way the air is circulating in a plane, it's much less risky than any other of those other modes of transportation, right? It's being filtered out and it doesn't recirculate on the plane. So as far as the air, it's one of the safest transportation modes. The issue is keeping people separate, and whether they're going to be enforcing masking and other things, right? So that passengers can protect each other. And how feasible is that going to be for them economically to skipping rows but it sure is a lot more economical than nothing, which is what's happening now. So it's just going to be a matter of how the airlines themselves adapt, and then these sort of immunity passports and what each country is gonna demand upon entry and then upon return. And none of that has been worked out yet. I don't know that I could answer that.
Right. So you said something that's interesting, because I think I was always under the impression that the air in the plane, that it just recirculated that same air. So
No.
I would have thought being on a plane is not one of the safer methods of travel in a situation like this.
Right. And the airlines have tried to put out a lot of videos and explanations on how the air circulates on the plane, and it's removed essentially, so it doesn't recirculate. So as far as comparing that to the subway and a bus, and where everybody's breathing the same air, that is different on a plane. So from that standpoint, it's technically safer.
Okay, interesting.
Yeah.
So, as you know, Brian and I were planning on getting married in Jamaica in August, and just made the call to cancel the wedding because we wanted to let people off the hook. His parents are in their 80s, and we just have a lot of family members that are concerned. They want to be there for the wedding, but they're concerned about what happens if we get there and then we get sick and we're not going to be able to come back. Like, what happens then? So, that's the big question. What happens if you're in another country and you do test positive? Where do they keep you? So
Right.
I think that's the concern that a lot of people have. So I think this is going to be affecting travel for a while. We're still scheduled currently to go to Peru in September. We will see what happens.
Yeah, and I mean, I'm not gonna lie, I'm still hopeful. I'm not gonna, if I'm completely honest, I'm one of those people that are still hopeful that we're able to do that. But
I am too.
we're human too.
Yeah.
We try to do everything by the book and follow all the rules, but still hopeful. Again, knowing this is gonna be with us for quite some time, and how do we adjust and adapt to that? I know that there's a lot of things that are changing very rapidly. We've been able to place patients in so-called COVID hotels, right? COVID positive hotels, where to prevent them coming back into their homes and infecting other people, right? And other countries are doing the same. So it's just a matter of how each different country and how much of that is already in place, and how much is that going to be open to their non-citizens, right? And how they're going to handle their non-citizens. At the same time, the treatment needs to be sort of equal, but it's so hard to predict across the board how that's going to go. And then getting stuck somewhere, at least for me, I think about this all the time. I've gotten medical health, health insurance for international health insurance in the past, depending on where we end up going. because the healthcare systems in other countries are definitely not what they are here, you know, and some are better, but some are definitely not better. So that's another concern for people is am I going to get stuck in somewhere where maybe the level of care is not going to be the same, and my chances of survival are going to be less, right? So
Right. That's why I wanted to talk to you, because I wanted to get some straight up facts and information that wasn't being colored by which media outlet was sharing it and whatever their political agenda may or may not be, and the conspiracy theories that are floating all over social media right now. And a lot of people that I know to be very, very, very smart that are spreading those conspiracy theories. So I got to the point where I was like, I have no idea what's going on right now. I don't know what the truth is. And I don't want to assume that I'm the one that has the right information, that I'm the one who's thinking correctly and thinking clearly and has it all right in my head. So that's why I wanted to reach out to you and say, okay, what's going on?
yeah,
What is the
absolutely.
truth? Yeah. And so this is really, really, really helpful. So some of my takeaways from this are, this virus is not going anywhere. So we have to learn how to live with it and how to adapt. And you said something when you and I were speaking yesterday about, you referred to it as calculated risks. So in certain situations, if it's important to go somewhere, to do something, to see somebody, you weigh the risks that are involved with that, because that's really all we've got at this point in time, is learning to live with this, adapting, and making the most responsible choice we can. Continue to social distance, and if you are going to be out, wear a mask and wash your hands. What else do we need to know? Is there anything that I'm missing? Is there anything else that you want us to know about COVID?
Yeah,
And
I think a lot of people have questions on how it's transmitted and the whole asymptomatic spread. I think we covered a lot of that, right? As far as the respiratory secretions being the main route of transmission, the main route somebody's going to get contagious, right? It's important to clean the high touch surfaces, so to speak, but that mode of transmission certainly seems to be on the lower end of things. Direct, just respiratory droplet spread seems to be the main mode of transmission. A lot of people have concerns about that. The whole adapting and continuing some form of physical distancing and social isolation, obviously staying away from mass gatherings. Mass gatherings are defined as greater than 250 people, right? But within smaller gatherings, the CDC website will tell you more than 10 is too much. 10 or more is too much, right? So, and I'm not saying that if you're going outside and sitting on your porch and you want to go, it's a somewhat private area that you can take a walk on because it's a wide open area, and maybe there's not that many people that you're going to come in contact with. Maybe the use of the mask is more free, but again, the recommendation by the CDC is anytime you're going to come in, you could potentially come in contact with another person, both should be wearing a mask. But there's some liberties that are just more common sense, right? Using your common sense.
So how airborne is it? So I've heard, rumors that if you walk into a space, if it's lingering in the air, if there was somebody that was in that space or walked by, that you could be walking right into this germ cloud. How much truth is there to that?
Yeah, so I'm glad you asked that. So we healthcare professionals do not refer to it as an airborne virus. The airborne route of transmission does not apply to COVID. It is droplets, right? And that has to do with the density of the respiratory droplets. How long do they stay up in the air before they fall? And that's the difference between a droplet and airborne, right? And so the airborne tend to be smaller particles, and they tend to stay in the air much longer. And that's the whole idea of walking into a cloud of something. That is not the case with COVID, right? You see, people get confused because they see healthcare workers wearing N95s, which are respirators, which are for airborne protection. But the reason that healthcare workers we are encouraged to wear the N95s is because we're doing certain procedures that may cause the virus to become airborne, right? So if a patient goes into respiratory distress and they need to be intubated, that procedure of intubation can cause the viral particles to become airborne. Patients in the hospital that may need suctioning, right? Anytime you're applying more air, more pressure, CPAP, BiPAP, those kinds of things can make, they're called aerosol generating procedures. So that's when the virus becomes airborne. Somebody goes into cardiopulmonary arrest, right? And you need to resuscitate them. So all of those things can happen at any moment in the hospital, right? So we can't have healthcare workers that are working in these COVID units. Oh, let me switch my mask real quick, right? So that's the difference. And I think there's a lot of confusion there because people see in the media pictures of in the beginning, even like Ebola looking suits, right? So it caused a lot of confusion. In the beginning, we knew less and less, right? So everybody was a lot more aggressive up front. The more that we know about it, the more we kind of adapt to what are precautions that we should be doing.
Okay, so this is not an airborne disease. We're not as concerned with surfaces. However, if it's a surface where there's a lot of common activity, it should be cleaned frequently, but mostly we're talking about droplets, and this is why everybody wearing masks and washing their hands is the wisest thing to do, keeping that social distance.
100%. Because again, for example, somebody not wearing a mask coughs on their hand, opens the doorknob, and then you go and touch that same doorknob right after, and then you touch your mouth. That is definitely a possibility, right? But as far as groceries and touching it in other ways where, somebody that touched that was wearing a mask and they're doing everything right, that's not as important of a route.
Okay. Okay, so and then I think one of the last things that I want to ask you is kind of a scenario. So someone that I know works at a convention center where there are lots of conventions, and in fact there was a convention where there were people from Wuhan, China there back in, I think it was in December. And so the question is, if these employees, if people at the convention center had been exposed to COVID-19, because there were people that said they were sick and they didn't test positive for the flu, and they think maybe that they had COVID-19, it was just that nobody knew about it yet. Number one, is that the possibility? Number two, if they were to get tested now, would it show that they have the antibodies? I'm not sure if we actually covered that question.
No, so that's a good question. Yeah. So the way to test people that are with symptoms, that we want to see if they have the disease and can actively be shedding disease to others, we do what's called a PCR test. They jam this thing up your nose, a swab up your nose, and that's how we tell for active cases, right? We're also testing in the blood for antibodies, right? Having antibodies in the blood is specifically something called IgG. It's a type of immunoglobulin. That is how we get an idea of, was this person infected, and maybe they either had some mild illness that was like, oh, maybe that's when I had it and I didn't even know because it was kind of mild. It was kind of a mild illness, or I never got tested, or it was early on. And now we can track those with antibodies, right? That being said, I like to remind people, medicine, as much as it is a science, it's an art, right? There's a lot of gray areas, and that's hard for a lot of people to process, right? Because after all, science is not supposed to be so gray. But the problem with those antibody tests is that they're only as good as the prevalence in the population, right? So in other words, if the disease has very, very low prevalence, there is a chance you're going to get some false positives there, right? And that's just a phenomenon that happens all across the board with all diseases, a lot of diseases. So, but for example, somewhere like New York, New Jersey, where at one point 40 to 50% of people were testing positive, if we were to go back and check antibodies on a lot of the people in New York and New Jersey, those tests I would feel more confident in. But eventually we'll get to the point where doing these antibody tests we'll get a better idea of what our prevalence is in the population. And we can tell people, oh, look, it looks like maybe you had a disease, especially if they can remember some kind of syndrome that perhaps was consistent.
Okay, so the antibodies test may not be 100% accurate, but it'll get better over time.
It'll get better over time. And it's the only thing we have to get an idea of what our prevalence is in the population. How many people have already had the disease that maybe we did not detect back then, right? And there was a really interesting New York Times article that was published over the weekend that talked about, basically they've done all this analysis of the virus and its genetic composition and mutations. And when the first cases of COVID were reported in the United States, on March 1st, we had 23 reported cases in the US of COVID-19. Now there's all this research studying the viral genetic composition, the mutations of the virus, going back and tracing back and doing more travel histories and contact tracing. This was all out of the Harvard Public Health School, where now they're saying the actual number of cases was more on the 28,000, right? So we're talking, it's a huge difference.
Yeah.
23 reported cases on March 1st, but really, in actuality, we probably had 28,000 cases around that time already by March 1st. And what was that factor of? We weren't testing people.
Right.
So there was already all this domestic spread, which, by the way, mostly was linked to New York. If they looking at that viral genetics, for example, Louisiana, right? I was telling you the other day that New Orleans and Louisiana was a big hotspot for disease. 100% of those viruses, looking at the genetics of the virus, look like the virus from New York. So it looks like a lot of our domestic spread came from New York, and the cases in New York seem to be mostly linked to Europe, right? So not to China, but to Europe. So yeah, so I think it's that same idea. You're talking about people at a conference and this and that. Yeah, we definitely had a lot more disease than we knew of very early on, and that's the case for most places.
It seems like I just keep coming up with more questions. So back to the test and the nasal swab that doesn't sound very appealing.
It's not.
How accurate is that test, and how quickly are we getting results now?
Yeah, so good question. So that has also improved significantly through, over the months. So the original PCR test, nasal swabs, were not very sensitive for a number of reasons, but they just, and what that means, we had a higher chance of missing some of the cases. Now, our testing has improved significantly. So those nasal PCR swabs now, the ones that we're using in most of our hospitals, are a lot more sensitive, meaning we should be picking up all the cases, or not all the cases, the majority of the cases, and much more than we were. So if we were picking up 75% of the cases very early on, say in February, March, now we should be picking up closer to 95% of the cases, with some exceptions.
Okay, and how quickly are people getting results these days?
So it really depends. It varies a lot in the setting. So my hospital, for example, we have an in-house test now, right? So that was a lot of we've come a long way, right? We went from initially only being able to send our testing to the Florida Department of Health. Before that, we had to send them all to the CDC. To now, every hospital, most places having their own in-house test, or in outpatient settings, they send it to the local private labs like Quest, LabCorp, the same way you get your labs done in general. So in hospital testing, my hospital will have an answer in 1 or 2 hours. Those ones that we're sending to the private labs like Quest and LabCorp, the average turnaround time on those has been closer to 72 hours.
Once you've been exposed, how soon should it show up on a test? Because I've been hearing stories about how somebody tested negative one day and then the next day tested positive.
Yeah, and that goes back to what I was saying as far as, so we know that once you get exposed to the virus, most people will develop symptoms within 5 to 6 days. Okay. We know that 95% of people will develop symptoms by day 11. And then a couple of stragglers, on those last few days, which is why we have determined the incubation period to be up to 14 days, right? So, because we're taking into account worst case scenarios. Testing, from what we've been seeing, is best. The highest chance of having a positive test is early in the disease once you started having symptoms. So you became symptomatic today, within those 24, 48 hours is when you have the highest chance of becoming or of having a positive test. Depends how out of control the disease gets in your own body, then maybe later on you can still obviously test positive, but we know that those first couple of days of being symptomatic is the highest chance of becoming positive. And then, like we were saying before, there's just we don't have a whole lot of great information on which ones of our asymptomatics are testing positive and which ones are not.
Okay, so of the people who do get sick, it can run the gamut as far as what the symptoms are like. They could have absolutely no symptoms to very mild symptoms to very extreme severe symptoms. And in most cases, those extreme severe symptoms are with people who already have a compromised immune system or some sort of underlying health condition. So it's not like COVID-19 is a death sentence for the majority of the population. However, there are certain people that it will hit very, very hard. I know when I spoke with you, you told me of a couple different stories of a gentleman who was 88 years old and he made it. Like, you weren't sure if he was at first, and he made it. And then you told me about somebody else in their 90s and they made it. So no matter how old you are, that doesn't necessarily mean it's a death sentence, right? So
Absolutely.
So that's one thing. And then the other thing that I wanted to ask is, so then keeping ourselves as healthy and as strong as possible, keeping our immune systems as boosted as possible is always wise, especially now, right? So keeping our thoughts positive, I would say all the things that we would do to keep our immune systems healthy, right? You get exercise, you get some sunshine, you drink lots of water, you get plenty of rest, eat healthy foods instead of lots of sugars and alcohol and things like that. But also just like keeping our headspace positive, knowing about that mind-body connection. So people who are turning the news on the minute they wake up in the morning and they're just watching one horrifying news story after another, and then they get on social media and they're engaging in or looking at or listening to conspiracy theories, and then they're getting back on the news to get the latest update. I mean, if we're constantly getting our systems bombarded with that fear, that's got to deteriorate the immune system. It's got to break down our vitality, right? Our strength.
Yeah, absolutely. And it varies. Everyone has different ways in which they cope with stress. And some people are much better than others at how they cope with their stress and how they cope with all that information coming in and how much anxiety does it cause them. We all have different levels of how we cope with it. I find myself at work saying this frequently, and I heard this once before. Never let a good crisis go to waste, right? So everything that we can learn and apply and make us better overall, healthier, more at peace, more able to handle stress. Nothing like this opportunity that has given us so much time with ourselves to take advantage of those things. If the worst thing that happens is we all do better at washing our hands and keeping each other disease free, then that's definitely a good thing. So
yeah, absolutely. Yeah,
more educated and sort of in a way more respectful of things that can happen in the blink of an eye. I mean, I anytime I see any of those videos of New York and the 7 p.m. shift change when everyone's celebrating their healthcare workers and we're not necessarily only idolizing our professional sports teams, nothing against professionals. I love me some professional sports. I'm just saying, it's just, it puts a lot of things into perspective and from my standpoint, I think, why not reconsider what we're doing from a healthcare perspective as a whole, as a system. And, even things related to employment-based healthcare benefits, right? How many of our population is unemployed now? And we need to rethink those things, right? Because now so much of our population is unemployed. That's what they depended on for their health insurance. And now what we're going to just have a bunch of uninsured people, which would work if our healthcare system wasn't an insurance-based healthcare system, right? But so we're going to have to get creative on a lot of things. And again, don't let a good crisis go to waste when it comes to this.
Right. It'll be interesting to see what comes of this. And on an individual level, it's been interesting to see how many people are gardening more and baking more.
Even when I go outside and ride my bike now, or try to do everything, take a walk, so many more people are out there, which in a way everyone kind of gets scared about, but at the same time, it's good to see what people, maybe they're mobilizing more. Maybe this is going to end up being a good thing for them, for their health at the end of the day, because everyone's trying to get some time in the sun, some vitamin D, some exercise. You and Brian yoga videos have kept my sanity, in a lot of ways, and trying to sort of take that time for myself and stay healthy myself as well. So
nice. I'm so happy to hear that.
yeah.
Well, thank you. I think that you've answered all of my questions. I mean, I think we know what we all individually need to be doing, and hopefully we can start thinking about this collectively, seeing everybody as a brother and sister. And so instead of looking at it as you're infringing upon my rights by requiring me to wear a mask, it's more of I'm wearing a mask because that's my way of honoring you and being a productive member of society and a contributing member of the community. And so I think it's just a subtle little shift that has to happen in people's minds to start seeing it that way.
Absolutely. And I like that. I in a lot of my talks, I have a couple of slides of the alternative handshakes and how to greet each other from this point on, and whatever the case may be, but also about that very idea. Let's be a little more conscientious and responsible for each other, and kind of think back about our moral and civic duties to protect each other, right? It's not some sectors of the population that are only responsible to sort of save and protect, right, and keep people healthy. It should be all of us.
Right.
Yeah.
Awesome. Thank you so much, Vivian, for taking the time.
Of course, and it's a possibility, and some questions come up as you post, or as and people post questions. It may take me a while, but maybe I can get around to answering some of those.
Yeah, absolutely. I'll forward on any questions that I get, and that would be wonderful. So thank you so much for putting this time aside, and hopefully you're giving yourself a lot of downtime to rest and recover and have some fun in the midst of all of this.
Yeah, I'm trying to. I'm getting there.
Awesome. Thank you so much, Vivian.
Yeah, it's good to see you. Take care.